Hello, listeners. Welcome to Views on Health. A great pleasure to have with me on the program tonight Dr. K.A.M. Ariyaratne, consultant venereologist of the National STD AIDS Control Program of the Ministry of Health. As everybody knows, World AIDS Day is marked on the 1st of December, and Sri Lanka is following the world theme of End Inequalities, End AIDS, and End Pandemics. The world over, we have been facing the pandemic of COVID-19, while AIDS has been going on in the meantime, affecting people across the world, not only in Sri Lanka, and that was an issue which the whole world faced, but thankfully over a period of time, things have improved so much. And as a matter of fact, even awareness has been created to make people come forward and say, I've been affected, or I think I've been affected, can I get myself checked? That is in Sri Lanka, which augurs well for the National STD AIDS Control Program. Having said that, may I invite you, Dr. Ariyaratne, to give us an overview on AIDS.
Thank you, Fatima, for having me. Now, as you know, AIDS has recognized as a medical problem way back in 81. So this year is a special year. That means it completes 40 years of knowing this disease. But as you know, HIV had been around a few decades before. But even today, it is a significant pandemic. And because of the COVID pandemic, now we have to deal with two pandemics at the same time. So as far as HIV pandemic is concerned, in Sri Lanka, always it had been a low-level epidemic, and still around 300 to 400 new HIV cases are getting reported from Sri Lanka. And now effective treatment is available, but compared to some of the other diseases, HIV, AIDS, they have some special problems. We have to deal with stigma and discrimination and so many inequalities. So that makes dealing with HIV especially challenging. But however, there is a hope. Now there is effective medical treatment is available, but unfortunately still HIV is not curable. We can't completely cure, or even after 40 years, still we don't have a effective vaccine. So that makes HIV a unique challenge. Because of this new medical advancement of effective controlling, now HIV has become a chronic manageable disease, bit similar to diabetes, pressure, and similar diseases, because once we get those diseases also, we have to keep them under control with medical intervention. So similarly, people who get HIV also, if we diagnose them in correct time, and if we give them good treatment and care, they also can live a fairly normal life. So that is the difference compared to early 80s. HIV was a death sentence, but it is no longer a death sentence. But the important thing is, a lot of people who are infected with HIV still not aware that they are infected. So what happens is, after 8 to 10 years time, their immunity will get destroyed and they will end up in ICUs, and that may be a little too late to recover them. So important thing is to test for HIV, know the status, and if they are positive, then get treatment. By doing that, we can get an additional advantage. That is, if we give treatment, their viral load become very low, come to an undetectable level, so that HIV is not transmissible to someone else. So there is a saying that U equal U. That means undetectable equals untransmittable. So that is the current status as far as the HIV/AIDS epidemic is concerned.
You said there are 300 to 400 new cases. It's every year.
Yeah, it is every year. Now, the first case reported, as you can remember, way back in 1987. So initially there were, few cases, and then it became 10, 15, and then hundreds, 200s, and during last 4-5 years, 300 to 400 new cases are getting reported. But these cases might have got infected several years ago and then get reported during this year because they have undergone testing during that particular year. So last year there was 363 cases, and the previous year 400 odd cases, 460 cases. So there was a drop of about 17% during last year, probably due to our treatment services got disrupted because of the COVID-related lockdowns and pandemics. So that must be the reason. So we have to, it is a challenging, as I told you, because of the COVID, a lot of testing programs got affected. So that must be the reason for this drop in cases, and that is not good. We want to diagnose as much as unknown cases possible so that we can start them on treatment and make them well. In the sense, even though we can't cure, we can keep the disease under control and prevent others getting infected from them.
When this theme says end inequalities, what does it mean? What is the focus to end inequalities?
Yeah. Now, compared to a lot of other diseases, like even cancers, TB or infectious as well as non-infectious diseases, HIV has a special problem of stigma and discrimination. So having these inequalities fuel the epidemic. Now, for example, those who are most vulnerable to HIV are the people who are, marginalized populations in a society. For example, sex workers, and then transgender people who use drugs. So those people, because legal issues and then the perception of the society and all that, we don't treat them equally, and they don't have the same opportunities as others to get protection as well as to get treatment. So, in global context, that's a very big issue, and then we want to end inequality so that people can get adequate knowledge on the first hand, and then they can get protection like everybody else and get access to HIV testing and treatment and so on.
Doctor, we are aware that the campaign conducted by the ministry to create awareness and to get people to come out and say, it is, I may be affected, can I get tested? And then also to end the discrimination within families, within society, in places of work, because there was all of that we faced years ago. But over the period of time, we've noticed that people are more receptive. It has changed. The thinking has changed. They're more positive. So to that extent, the campaign has reached a certain degree, I would say, of positive response from the general public. Please correct me if I'm wrong.
No, you are correct. Now, compared to 10-15 years, we are much better off now. People are aware that they consider it as just an infection, but still, certain degree of fear which lead to, discrimination and stigma still happens. So that prevent people accessing treatment services, the testing services, treatment services, etc. So that is the one which we have to minimize it. There is always room for improvement.
Doctor, of course, as we know, it's sexually transmitted. Of course, there could be infections through, if they say they're into drugs and they use the same needle, when they inject each other, and that type of thing, the negative side of social behavior. and personal behavior. So taking that into consideration, if obviously your campaign targets the public to create awareness, to say that a person who has HIV will not necessarily affect the person sitting next to him or her, just like that.
Yes, actually, fortunately, unlike, for example, COVID, HIV is not transmitting like, just sitting next to you or breathing the same air or coughing or something. So HIV transmitted in some very specific means. For example, through sex, unprotected sex with somebody with HIV. So that is the commonest mode, and over 90% of all the cases were transmitted either through heterosexual sex or homosexual sex. And then in addition, unsafe injecting practices among those who inject drugs. And the other thing is mother-to-child transmission. I mean, those are the three commonest methods of HIV transmission. And I should say that last year also we told we managed to eliminate mother-to-child transmission of HIV and syphilis, and we got the WHO certification for that. But then elimination is, we can achieve it, but then we have to maintain it. So after 2 years this year, we have to undergo another test to show, to prove WHO that we are still maintaining the same standards of, this prevention of mother-to-child transmission services. So now similarly, now the talk is there whether we can end AIDS epidemic totally. Again, ending or eliminating does not equal to eradication. We cannot eradicate a disease unless we have a very effective vaccine. For example, we eradicated smallpox because there was 100% effective vaccination, and everybody got vaccinated, and then it got eradicated. But elimination or ending, you can end it in a geographical area, but then you have to maintain all the services that you offered to maintain that. So that is why even HIV/AIDS, this mother-to-child transmission thing, we have to provide services continuously. Otherwise, again, it will come back.
Taking on from there, Doctor, just to ask you, the other aspect of the theme, End AIDS, how does that happen? We are all hoping for it. You just said that there's still no vaccine even after 40 years. So isn't that very ambitious, wanting to end AIDS? We want it to happen, but how does it happen?
Well, again, like ending mother-to-child transmission of HIV and syphilis also, ending AIDS has some definition. Now, according to the definition, we have to reduce new HIV infections by 90% and reduce AIDS deaths by 90% compared to the level that we were in 2010. So that's the definition given by WHO and UNAIDS. So any year when we received that particular target, we can end AIDS. So it is country specific based on countries' numbers. So we are trying our best to achieve that target. That is how it is defined. But then after that, we have to maintain that status.
Would you be able to tell us if the steps being taken to develop a vaccine, how much of progress has been made, if it's possible?
Well, there had been several vaccine trials going on, and some were tested in the field, but so far, unfortunately, there is no effective vaccine that can be used as an effective prevention method. But scientists do carry on these researches, and I hope in future there will be a vaccine. But that might take maybe 5 years or 10 years, we never know, because HIV is unique. Now, COVID, of course, within a matter of few months or years, scientists managed to develop vaccine. So HIV doesn't work that way. So it takes a little longer, but then technology is innovative, and there will be new technologies available in future, and eventually it will happen. But at the moment, our strategy is to diagnose. First thing is we have to give knowledge and prevent new HIV infection. That means to avoid unprotected sex. And now there are drugs which can prevent getting HIV, even by having certain risk behaviors. Those drugs are given now in Sri Lanka for high-risk groups. And also after getting exposure, there are certain drugs that can be given to prevent getting HIV infected. So they are called pre-exposure prophylaxis and post-exposure prophylaxis. And then usual behavioral methods like promotion of condoms and so on. So the prevention is very important. But once someone gets infected, then the method is to detect them by using a HIV test earlier the better, and then start them on these antiretroviral drugs, which will make the viral load to a very low undetectable level. So that will do two things. One thing is, it maintains the health of the person who can go back to work and, have a family life and all that. And the other thing is HIV is not transmitted from that person to another person. So that is why we promote HIV testing in a big way while continuing the primary prevention work.
And finally, you said effective treatment is available in your introduction. Also, you did say that drugs are being given, and people are getting more and more protection by taking drugs. Could you just comment on that, please?
Well, effective drugs in the sense, as I told you before, the drugs will not cure HIV. HIV will be, HIV will come back if we stop drugs. So once we start drugs, they have to keep on taking drugs every day. But usually, it comes as a one pill with a combination of 2-3 drugs, usually 3 drugs. So that is effective in the sense once you get that, after several weeks, the HIV viral load, the amount of virus in the blood will go down, and the patient will feel better, and then HIV is also not transmitted from that person to another. So that is what I call effective treatment. And then we have over 30 clinics from where we can provide this treatment island-wide. Almost every district there is a clinic. So people can either go to their own district, or they can go to a different clinic of their preference and get this treatment. And the other thing is, while they are on treatment, we have to monitor their immune function by doing certain blood tests. So they are also given by the government free of charge. Even the drugs are given free of charge. So that is the kind of service that is maintained by the National STD/AIDS Control Program.
You did say that chronic manageable diseases, that HIV comes under that category now.
It is.
So therefore, by that line of reasoning, we assume that the treatment is for life.
Treatment is for life. At the moment, that is the situation. But you never know. There are certain investigations going on. Sometimes, one injection can be given, once in 3 months. There are, certain trials are going on. Once they come, the treatment, from the patient point of view, the treatment will be even easier to take.
And just what is your take-home message, Doctor?
Well, my take-home message is, best thing is to prevent HIV, you getting infected with HIV by avoiding all the high-risk behaviors, especially unprotected sex with unknown people. That is the first thing. And never share injecting equipments. That is the second message. And also, if someone is pregnant, the clinic usually provide HIV testing and testing for syphilis free of charge. Do not refuse them. And then by doing those things, we can prevent HIV. And also, if you happen to have unprotected sex outside or take some kind of risky behavior, then go for HIV test. And then make sure that you are not HIV, and if you are HIV negative, remain in that way. In case if you are HIV positive, get treatment so that you can live a near normal life. That is the take-home message.
Thank you very much to Dr. K.A.M. Ariyaratne, consultant venereologist of the National STD and AIDS Control Program, Ministry of Health, for sparing your very valuable time to be with us on the program. Thank you so much, Doctor. Truly appreciate your input to mark World AIDS Day. The theme, End Inequalities, End AIDS, End Pandemics. My thanks also go to Achala Gunasekara for technical assistance. Thank you, Achala. I'm Fatima Razi Kadasing. Good night, and hope to be with you next Monday, same time on Views on Health.